the dissection of the gluteal region. We have removed the skin and superficial fascia from the gluteal region. Now, here first we see the muscle. This is the gluteus maximus muscle. The origin of this gluteus maximus muscle is behind the posterior gluteal line. It also takes origin from sacrotuberous ligament and side of the coccyx. The gluteus maximus take insertion in 1/4 part of gluteal tuberosity and 3/4 part in iliotibial tract. The nerve supply of gluteus maximus is inferior gluteal nerve. When we remove the flap of the gluteus maximus muscle, below here we are seeing the gluteus medius. This muscle takes origin in between the posterior and anterior gluteal line and takes insertion on greater trochanter of femur oblique ridge. The nerve supply of gluteus medius is superior gluteal nerve. The flap with the gluteus maximus also has gluteus minimus. The gluteus minimus takes origin in between the anterior and inferior gluteal line and insertion on greater trochanter. The nerve supply is superior gluteal nerve. The fourth muscle, after we place the flap again of the gluteus maximus laterally, there is the tensor fascia lata muscle. It takes origin from anterior superior iliac spine, outer lip of the iliac crest, just behind 5 cm from anterior superior iliac spine. The insertion of this tensor fascia lata is in iliotibial tract. It is supplied by superior gluteal nerve. Now when we take the flap of gluteus maximus, below we are seeing the piriformis muscle. The piriformis muscle will take origin from pelvic surface of the sacrum, upper margin of the greater sciatic notch. The insertion of this piriformis is at the apex of the greater trochanter. It is supplied by ventral rami of S1 and S2. Below piriformis, here is the sciatic nerve. The muscle which is seen is the superior gamellae. The superior gamellae takes origin from upper part of lesser sciatic nerve. The insertion is on the medial trochanter and it is supplied by nerve to obturator nerve. Below the superior gamellae is the obturator internus. The obturator internus muscle takes origin from pelvic surface of ischium and pelvic surface of istiopubic rami. It is inserted on medial surface of greater trochanter and supplied by nerve to obturator nerve. Then comes the inferior gamellae below the obturator internus. The inferior gamellae takes origin from lower part of lesser sciatic notch. It is inserted on medial surface of greater trochanter. It is supplied by nerve to quadratus femoris. Below now inferior gamellae there is the quadratus femoris. This quadratus femoris takes origin from lateral border of ischial tuberosity. It is inserted on the quadrate tubercle of femur and is supplied by nerve to quadratus femoris. We are also seeing here the ischial tuberosity. The ischial tuberosity gives origin to the hamstring muscle. The ischial tuberosity is first divided by transverse ridge into upper area and lower area. The upper area is again divided into two parts, that is superolateral and inferomedial area. From the superolateral area, semimembranous muscles takes origin. And from the inferomedial, semitendinosus and biceps femoris. Semitendinosus and biceps femoris will take origin from inferomedial surface from the upper part of the ischial tuberosity. The ischial tuberosity on the lower part is again divided into outer and inner area and gives origin to the adductor magnus from outer area. The adductor magnus. This is the adductor magnus. Now, just medial to the ischial tuberosity, there is the great sciatic nerve. Sciatic nerve. Sciatic nerve is the branch from the sacral plexus. It is the largest nerve of the sacral plexus. The root value of the sciatic nerve is L4 to S3. It has two components, that is tibial component and common peroneal component. This nerve is formed on the pelvic surface of the sacrum, and it takes exit from the pelvic region through the greater sciatic foramen, and it descends downwards on the back of the thigh through the gluteal region. The biceps has also a short head which will lie just below the long head of biceps. This is the biceps short head. The biceps short head will take origin from lateral lip of linea aspera, upper to third part of the supracondylar line and lateral intermuscular septum. The hamstring muscles goes downwards and form boundaries of the popliteal fossa. The popliteal fossa is present just behind the knee joint. It is a diamond-shaped structure having superomedial, superolateral boundaries and inferolateral and inferomedial boundaries. This hamstring muscle forms the boundaries of the popliteal fossa on the superior side. Thank you.